This is Jacob Nelson, Medication Administration Skills Checkoff. My ID. I am fully in my scrubs and shoes. Alright, so now I'm going to show you my room that I'm in. This is the kitchen table that I'm working at, and I'm in my kitchen. Alright. And for clarity's sake, this is my patient room over here, and this is my medication storage room. So the first thing I'm going to state is that administration of medicine should be done in a quiet and calm environment. The door should be closed. I should limit conversation with colleagues, and I should not be on my cell phone, and I should follow my agency's no interruption zone policy. All right, so now what I'm going to do is I'm going to compare my order sheet with my MAR. All right, so correct patient, we have Jaguar J. Jones, date of birth 8/25/1963. Medical record number is 417-6352. And I note allergies to penicillin. So we have the correct patient. All right, I see on the back of the page of the MAR on the second page and the bottom line of my order, I have morphine sulfate, 5 milligrams, intramuscularly, every 4 hours, and an indication of pain, and all legal aspects of a medical prescription present. So this completes my need of the order sheet, so I'm going to put it aside, and now I'm going to continue with only my MAR. Now is when I would perform hand hygiene, and I'm going to begin my first check of accuracy. So we have Jaguar J. Jones, date of birth 8/25/1963, medical record number 417-6352. So the correct patient, morphine sulfate. All right, this is my morphine sulfate vial. I'm going to visually compare my vial with my MAR. So I see morphine sulfate. 5 milligrams is what my MAR calls for. The vial is labeled 10 milligrams per milliliter. So this means I would need to draw half a milliliter of solution. I noticed the expiration date on the morphine sulfate is 12/20/2025, and this is within date, so we can use this medication. Again, back to the 5 milligrams, and this being 10 milligrams per milliliter, so I will draw up half a milliliter. This calculation would need to be double checked with another nurse, so now I am going to draw up my medication. Since it is intramuscularly, I will be using a 3 milliliter syringe. I'm shaking, sorry. A blunt tip cannula, and a 23 gauge needle. Alright, so I am going to use an alcohol pad to clean the top of the vial. Alright, I'm going to grab my 3 milliliter syringe, open it, going to grab my blunt tip cannula, screwing it on tight. I'm going to remove my cap, and now I'm going to draw back half a milliliter of air to inject into the vial. So since I have cleaned the vial, I am ready to inject and draw out. So I'm going to puncture this in. I'm going to inject the air, and then I'm going to pull back a little more than half a milliliter of solution to ensure that I have enough. Thumping out any bubbles, and now pushing back to my half a milliliter. Whoops. All right, I'm going to then scoop up my cap of my blunt cannula, unscrewing it, and now I am going to apply my needle cap. So again, now verifying my dose, so 5 milligrams vial states 10 milligrams per milliliter, so half a milliliter. This is half a milliliter. All right. You can check. The numbers are a little worn off. I apologize. I was practicing a lot. That's the half milliliter mark, and this is where the 1 mark would be. All right, so now that I have visually examined the volume and seen that it's correct, and again compared it with my vial, I'm again going to state that the route was intramuscular, which is why I chose a 3 milliliter syringe and a 23 gauge needle. So time is every 4 hours, and indication is pain. The patient reports pain, and all legal aspects of a medical prescription are present. So I have gone over the 7 checks, that being Jaguar J. Jones, morphine sulfate, 5 milligrams, half a milliliter, intramuscularly, every 4 hours, and indication of pain and all legal aspects present. So now I am going to move on to my second check. So again, we have Jaguar J. Jones, and again I'm going to compare my morphine sulfate vial and the dosage on the vial to my MAR. So morphine sulfate, 10 milligrams per milliliter, 5 milligrams, so I will only need to draw up half a milliliter. And this is half a milliliter. Again, with those calculations, I would need to have them cross-referenced with another nurse, as well as if indicated by the drug, I would have the volume and amount cross-referenced by another nurse as well. Intramuscularly, which is why I chose a 3 milliliter syringe and a 23 gauge needle. Every 4 hours, the patient has not received it in the last 4 hours. And PRN pain, the indication is pain, the patient reports pain, and all legal aspects of a medical prescription are present. So now what I'm going to do is I'm going to create a label for my syringe. There it is. I'm going to make sure I do not block any measurements I need or any readings. All right. And on this label, I am going to include the patient name, the drug name, and then the dosage. So we have Jaguar J. Jones, the J, morphine sulfate, and 5 milligrams per half a milliliter. So just to show the label, at the top we have Jaguar J. Jones, in the middle we have morphine sulfate, and at the bottom we have 5 milligrams per half a milliliter. All right, and again, just to make sure I have done everything right, we have Jaguar J. Jones, morphine sulfate, 5 milligrams, 10 milligrams per milliliter, so half a milliliter. This is half a milliliter. Intramuscularly, so 23 gauge and 3 milliliter syringe. Every 4 hours, patient has not received in the last 4 hours, and indication of pain, patient reports pain, and all legal aspects of a medical prescription are present. So now I am done in my medication administration room, and I'm going to move to my patient room with my vial, my syringe, and my MAR. All right, upon arrival, I will perform hand hygiene, and I will begin my third and final check for accuracy. This is my patient. This is my patient's armband. So I'll identify my patient. We have Jaguar J. Jones, Jaguar J. Jones, Jaguar J. Jones. Date of birth, 8/25/1963. Medical record number is 4176352. All right. And Mr. Jones, I notice you have an allergy to penicillin. Is there any other allergy you would like to let us be aware of at this time? No? All right, good. Well, that's fine. All right. So now I have completed the check of the patient, and now is when I would raise the bed of the patient, lower the side rails, and position the patient how I would need them for the procedure. I've identified the patient and I've assessed the allergies, and now is when I would explain the procedure to the patient what we were doing. So since I am administering morphine sulfate, I'm trying to alleviate his pain. Now is also when I would do a pre-administration assessment. I would ask the patient to rate his pain on a scale from 1 to 10, 10 being the worst pain imaginable and 1 being just a pinch, or whatever pain scale is necessary for the patient. So the patient reported pain. All right, so now I'm going to move on. So I've correctly identified the patient. Now we're going to move on to drug. This is morphine sulfate, morphine sulfate, morphine sulfate, Jaguar J. Jones, Jaguar J. Jones, Jaguar J. Jones. All right, it is 5 milligrams. This is 5 milligrams per half a milliliter. The vial states 10 milligrams per milliliter, so half a milliliter would be the correct dosage. Half a milliliter is in the syringe. All right, intramuscularly, so 23 gauge needle and 3 milliliter syringe, and I would choose ventrogluteal as that is the best option for intramuscular. So this will be the ventrogluteal of the patient. Every 4 hours, the patient has not received this in the last 4 hours, received this medicine in the last 4 hours, and indication of pain, the patient reports pain on the pre-assessment. So now, and all legal aspects of a medical prescription are present. So now I am going to goggle and glove. And so now on the ventrogluteal site, I will inspect the skin for any infection, inflammation, abrasions, or abnormalities. And since this is intramuscular, I would typically palpate for good musculature to ensure that I am injecting into a healthy muscle. So now that I've done that, I'm going to clean the injection site. With an alcohol pad. I'm going to work my way from the center out, leaving the alcohol pad on the corner pointing towards where I'm injecting. Since this is intramuscular, I'm going to part the skin and pull it apart. I'm going to decap my needle. I'm going to part the skin, stretching it apart. And again, since it's intramuscular, I'm going in at a 90-degree angle. I'm going to dart in. And again, since this is intramuscular, I'm going to aspirate to make sure I'm not over any veins or arteries or any blood vessels. I aspirated and I do not see blood, which means I can inject. So I'm injecting. All right, I'm going to pull out and hold pressure, making sure not to massage. I'm going to place my needle and syringe into my sharps container. All right, after applying pressure, I'm going to stop applying pressure. I'm going to take off my gloves properly, glove to glove, and skin to skin, and dispose of them properly. I'm going to take off my goggles, and I'm going to perform hand hygiene. I will return to the patient's bed after performing hand hygiene, and I will assess for any immediate allergic reaction, and then I'm going to raise the bed of the patient, lower the bed of the patient, raise the side rails, and position them comfortably. After this, I will leave the room to document on the MAR that I administered the medication, and then I'll also document how the patient treated the procedure, whether they treated it easily, went through any pain, or denied it. And then after documentation, I will return to the patient room and reassess for any allergic reaction. And that completes my skill checkoff.